Good evening, everybody, and welcome to our first of 4 webinars, which we are holding as part of our Animal Health and Antimicrobial Resistance Awareness Week, which runs this year from the 18th to the 24th of November. My name is Caroline Garvan, and I'm a Superintending Veterinary Inspector in the Department of Agriculture, and I'm going to chair this webinar tonight. The overarching theme for the week is future sustainability, economic, environmental, and social, both in terms of animal health and antimicrobial usage. Tonight's webinar is focusing in particular on antimicrobial resistance, or AMR, in particular given the day that's in it, because today is European Antibiotic Awareness Day. The title of this webinar is Handle Antimicrobials with Care, One Health. And the One Health theme is further emphasised in that today marks the launch of Ireland's second One Health National Action Plan to address AMR. But first, I will hand over to our Minister for Agriculture, Minister Charlie McConalogue, who will officially launch the webinar.
I'm delighted to be here this evening to launch this webinar titled Handle Antimicrobials with Care, One Health, which marks European Antibiotic Awareness Day today, Thursday the 18th of November, as well as the beginning of World Antimicrobial Awareness Animal Health Awareness Week, which runs from the 18th to the 24th of November. Following and building on the success of the animal health awareness events in 2019 and in 2020, and on the direct link between better animal health and reduced antimicrobial usage in agriculture, we have decided to combine both themes for 2021 Animal Health Antimicrobial Awareness Week. I welcome all of you who have joined today. I'm sure you will find this evening's speakers interesting and thought-provoking. Today on EEAD, I welcome the timely launch of Ireland's second One Health National Action Plan on AMR INAP2. I acknowledge the efforts and commitment of the staff in my own department and those in the Department of Health who work steadily together to produce this joint document, which sets out an ambitious roadmap for continued action to address the serious global, public and animal health threat of antimicrobial resistance, building on the achievements of INAP1 2017 to 2020. European Antibiotic Awareness Day and World Antimicrobial Awareness Week are annual events which aim to raise awareness around the global public health threat of antimicrobial resistance. Resistance to antimicrobials is one of the major current challenges facing all of society. When I refer to antimicrobials and AMR, I am specifically referring to antibiotics and antibiotic resistance. Within the One Health framework, AMR is now accepted to be a major global public health risk. AMR is a challenge for all of society. The fact that humans and animals share the same environment, are exposed to the same general families of bacteria, and treated with the same suite of antibiotics makes AMR a truly One Health issue. A lack of effective antibiotics due to AMR development is of direct relevance to human and animal patients and to human healthcare and veterinary professionals, indeed to society. Tackling AMR collectively across the three sectors of human health, animal health and the environmental sector is viewed as being critically important to achieving sustainable agricultural development and ensuring food security. AMR can threaten the inroads made in human and animal health over the decades in successfully treating antibacterial infection. Preventing and controlling infections that are likely to be treated with antimicrobials is one way of reducing the need for these medicines, and as such is fundamental in tackling AMR. The more we use and misuse antimicrobials in both human and animal medicine, the faster resistance will develop and spread. We need to take every opportunity to prevent infections and the need to use antimicrobials. We have adopted a One Health, One Welfare approach, which promotes a whole of society outlook, recognising that the health and well-being of people is connected to the health and welfare of animals, biodiversity and the environment. The goal of One Health, One Welfare is to encourage multidisciplinary collaborative efforts across different sectors, such as health, agriculture and the environment, to achieve the best health outcomes for people and animals. Such a One Health approach is recognised by all relevant bodies as key to tackling AMR. Ireland's second National Action Plan sets out an ambitious roadmap for continued action to address the serious global public health threat of AMR, building on the achievements of INAP 1. Our last National Action Plan has provided a very successful platform to implement policies and actions to prevent, monitor and combat AMR across the health, agricultural and environmental sectors, underpinned by a One Health approach. I thank the members of the National Interdepartmental Antimicrobial Resistance Consultative Committee, as well as the Animal Health Implementation Committee, for their advice and guidance in relation to the development of the plan. Antibiotics are the foundation of modern medicine, and since their discovery have been pivotal in saving countless lives and adding an estimated 20 years to human life expectancy globally. AMR continues to be of relevance to the animal health sector. We must all work collaboratively to ensure the best possible health outcomes for their animals and to only use antibiotics where necessary. The use of antibiotics in agriculture is coming under increased scrutiny. Ambitious targets outlined in the Farm to Fork strategy as part of the European Green Deal seek a 50% reduction in the overall quantities of antimicrobials sold across the EU by 2030, taking 2018 as a reference year. The new Veterinary Medicines regulation due to come into force in 2022 provides a wide range of measures to address AMR and promote a more prudent and responsible use of antimicrobials in animals. Antibiotics play an important role in the maintenance of animal health and welfare. It is an imperative to ensure that vets and farmers continue to have access to effective antibiotics so that they can continue to treat animals when outbreaks of bacterial disease occur, that they can protect animal welfare, that they can take measures to prevent the transmission of zoonotic bacteria. Optimal animal health is critical to the future profitability and sustainability of our farming and processing industries and to public health and the environment. Ireland is a globally recognised trading nation and has consistently provided high quality meat, milk and meat and milk products to countries worldwide. As you know, Ireland is a major food exporter, with the agri-food sector responsible for 10% of national exports, valued at €14 billion last year. I recently launched the Food Vision 2030 strategy, and this ambitious and innovative roadmap to further enhance Ireland's position as a global leader in safe, sustainable agri-food products. Protecting the economic, environmental and social sustainability of the Irish agri-food sector is at the heart of this vision. The environmental impacts of farmed animal production represent an important societal concern and contribute to the long-term sustainability of the sector. The establishment of the INAP Animal Health Implementation Committee, chaired by Dr. Martin Blake, Chief Veterinary Officer, in January 2018, has played a pivotal role in facilitating multidisciplinary collaborative efforts across key stakeholders in the animal health and environmental sectors. These actions provide a roadmap for a coordinated national One Health response to AMR that can be built upon. Actions taken to improve animal health and prevent disease are key to reducing the use of antibiotics and effectively tackling AMR. Many issues which affect the usage of antimicrobials will also be discussed during the series of webinars planned for Animal Health Awareness Week. I encourage you to engage with the events of the week, which starts next Monday and are listed on the gov.ie website. Healthy animals don't need antibiotics, and so better awareness around animal health impacts in a very positive way to address AMR challenges. AMR, just like COVID-19, does not respect borders, and with the increased global movement of people, food products and animals, AMR and the threat it poses to modern medicine is not something that any country can ignore. Reducing the use of antibiotics in animal production takes time, but we simply must tackle it. Irish farming is going through an era of significant change, but with change comes opportunities as well, and the challenge is to see and use these opportunities to enhance the sustainability of the agri-food sector. Again, I commend all stakeholders involved in INAP who are working towards delivering a key public good that best serves Ireland from a social, environmental and economic perspective. I look forward to continued positive engagement by all sectors and leadership around addressing the challenge of AMR. I hope this webinar leaves you all more informed about your respective roles and responsibilities as end users and prescribers to protect antibiotics for all our futures. I sincerely thank our guests for agreeing to share their perspectives and expertise with us. I now hand back to Caroline Garvan, your host for today, who is Superintending Veterinary Inspector in the AMR section of our department. Thank you, Caroline, and thank you.
Thank you, Minister.